Hi, my name is Lesiuk, and I'm going to be demoing insulin continuous infusion today. So to get started, I'm going to do hand hygiene. So we're going to review the physician's orders and the MAR. So we got here for patient Morden Jacob, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, followed by Dr. Amanda Jackson. Our patient has no known allergies. All orders are double signed and properly transcribed. So we're going to be giving insulin Humulin R continuous IV at 3 units per hour. Insulin Humulin R continuous IV at 3 units per hour. They're both matching for a goal blood glucose of 6 to 10 millimoles per liter. And we have infusion of normal saline to keep the vein open. We also have some other trach care general orders, which we're not going to worry about right now. So after that, I'm going to go to our parenteral drug monograph. So today, we've got here insulin regular or Novolin Tronto Humulin R. It's an anti-diabetic. Insulin is a high alert medication, so it is a 2-nurse check. In this demonstration, I will be acting as one of the nurses doing the checks, but in clinical, I won't count as one of the nurses. May be administered by a nurse or a student nurse. We know we have D50W readily available on the unit in case our patient is hypoglycemic. We're going to look here. The safe dose range for continuous IV is 1 to 10 units per hour, highly individualized based on blood glucose. We're looking here, our drug, so for IV continuous, it says to add 100 units using a 3 ml syringe with an attached blunt fill 18 gauge 1.5 inch needle to drop 1 ml of 100 units per ml insulin and inject the 1 ml into the 100 ml mini bag of normal saline. And so then we'll have a final volume of 101 ml and a final concentration of 0.99 units per ml. We're looking here, it's compatible with normal saline and D5W. Some potential hazards are that of hypoglycemia, so sweating, hunger, headache, palpitations. We'll make note of that. So after that, I'm going to get my medication and I'm going to do my first check here. So we don't need the physician's orders anymore.
We'll add 30 seconds there, no worries.
We're going to compare the MAR with the PDM and our drug here. So we got the right patient, Morden Jacob, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9. The right drug is insulin R. Here we got our insulin R regular. Here is our insulin regular PDM. The right dose is, so we're looking for a concentration of 3 units per hour. To get that, we are going to add 100 units of 100 units per ml here of this insulin. We're going to draw that up in a 3 ml syringe and we're going to inject that into a 100 ml mini bag of normal saline. And that'll give us a final volume of 101 ml and a final concentration of 0.99 units per ml. So here I have, this is the insulin Humulin R and it is 100 units per ml and it is not expired. There's 10 ml in here, so we're going to need that 1 ml. And so the right route, this is for continuous IV on the PDM, continuous IV here, compatible medication. The right time and frequency, hasn't been given yet today, so we're going to go ahead and give that and then sign for it. So after that, I'm going to do hand hygiene. And I'm going to start by swabbing off the top of our vial, our insulin, for 30 seconds, letting it dry for 15. For the sake of demo purposes, we'll say that was 30 seconds. So we got our 3 ml syringe here. We'll wing that back. Maintaining sterility, I'm going to draw back 1 ml. Going to inject our 1 ml and I'm going to pull back 1 ml here, pull back a little bit extra. We'll do our scoop method and then I'm going to knock out the bubbles. So I would go over med waste and get to 1 ml. So there is our 1 ml. I'll show that to the camera. Right away, I'm going to make sure to put my label on this. So I have made up a label. It's with our patient's name, Insulin R, 100 units, 1 ml. I'm going to stick that on our syringe there. And now we can do our second check here. So we're going to compare our drug with our medication, with our MAR, our parenteral drug monograph, and our mini bag here. So for the right patient, we got Morden Jacob. Right patient, Morden Jacob on our labels here. The right dose, the right drug is Insulin Humulin R. I have Insulin Humulin R parenteral drug monograph. Here I have my Insulin Humulin R vial. Here I have my Insulin Humulin R 1 ml, and I have Insulin Humulin R on all my labels. The right dose, so we're looking for a rate of 3 units per hour. In order to get that, we're going to follow our parenteral drug monograph here recipe, add 100 units using a 3 ml syringe with an attached 18 gauge 1.5 inch blunt fill needle to draw 1 ml of 100 units per ml insulin. Inject that 1 ml into the 100 ml mini bag of normal saline. We'll get a final volume of 101 ml and a final concentration of 0.99 units per ml. So that is the right dose, and here I do have my 1 ml. I'm checking and there's no bubbles. Here I have my normal saline. It's 100 ml of normal saline that is not expired. And here I'm checking my vial. I do in fact have the 100 units per ml. There's 10 ml in there, and I took out 1 ml. That's the right dose. The right route is continuous IV on the MAR here. Continuous IV is the recipe we followed, and our medication is continuous IV compatible. This is continuous IV, and this is continuous IV. I also have my tubing here that has no ports, and it is for insulin specifically for continuous IV, and I've labeled it with Insulin R. The right time and frequency, it is not given yet today. It hasn't been signed for. We're going to give that, so it is good to give today now. After that, I'm going to do hand hygiene. I'm going to make sure to get a second nurse to come in and independently verify all of my doses and numbers and everything. So after they come in and independently verify everything is all good, I'm going to open an alcohol swab here. I'm going to swab off the port of our 100 ml normal saline mini bag for 30 seconds. For the sake of demo, we'll say that was 30 seconds. And then I'm going to, maintaining sterility, inject our 1 ml into the bag. We'll do our scoop method and put that in the sharps container. I'm going to gently mix that up. And right away, I'm going to attach my label here that I've made up for my medication. I'm going to take my MAR, make sure that my medications are away in the appropriate spot. I'm going to get all my supplies, alcohol swab, my medication, and my MAR, and then head to the patient's room. So upon entering, I'm going to do my entrance safety check. I'm going to introduce myself. Hi, I'm Alex Lesiuk, student nurse. I'm going to be giving you your continuous IV insulin today. Could you just tell me your first and last name? So I would compare the MAR to their wristband here. We got Jacob Morden, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, followed by Dr. Amanda Jackson, that's correct. Do you have any allergies? They say they have no known allergies, so that matches. Just excuse me for a sec while I do my third check at the end of the bed here. So for my third check, I'm going to be comparing the MAR to our mini bag here with the medication in it. So we got the right patient is Morden Jacob. The right drug is Insulin Humulin R. I have Insulin Humulin R here. Insulin Humulin R on my line, the right dose, so we're looking to put in 3 units per hour. I have here 100 units in my 100 ml mini bag of normal saline, which gives us that dose of 0.99 units per ml, so we can get the 3 units per hour. The right route is, that's the right dose, the right route is IV continuous. This is IV continuous here. The right time and frequency, it has not been given yet today, so we are going to give that sign for that. So after that, I'm going to explain to Morden Jacob that today he's getting his IV continuous insulin R today. It's an anti-diabetic medication. Some side effects he might experience are those of hypoglycemia, so sweating, hunger, palpitations, or headache. If you experience any of those, please ring the call bell and let me know. We're going to be checking his blood glucose before we start this to get a baseline. As well, we're going to be checking it hourly while he's on the infusion. I'm going to be checking his vital signs periodically and also get a baseline set of vital signs. So the doctor has ordered this medication for our patient because he has type 1 diabetes and he's looking to get that blood glucose between 6 to 10 millimoles per liter. Our patient does have the right to refuse, but they said they're going to go ahead and they're okay with receiving this medication, so we can go ahead with that. So I'm going to head to the bedside here and I'm going to note that we do have a carrier hanging here and it is compatible. It's normal saline, it's not expired. I'm checking my lines to make sure that they are all unlocked. It's running gravity. I'm also going to palpate around our patient's IV site and note that they don't feel any pain, there's no swelling or induration, so that's good. I'm then going to take my bag and my line. And we're going to, maintaining sterility, prime our line. Just gonna move that tag a little bit there. Put that down. I'm going to lock our line before we spike our bag. So we'll just ask the patient if I can rest that there for now. I'm going to take the cap off of there, just put it in the garbage after, take that off like that, and spike our bag. I'm going to hang our medication here, and I'm going to make sure to fill the drip chamber to half to 2/3. I'm going to then prime our tubing. Make sure that there's no bubbles. So once I'm sure that there is no more bubbles in our tubing, so there's good there, I'm going to just lay this down on our patient right there. I'm going to go to primary. I'm going to go to colleague guardian. I'm going to find insulin. There's our insulin. I'm going to select that. And I'm going to, of course, grab my MAR. And I'm going to compare using our label and our MAR here. So we have the drug amount is 100 units. So that's correct on here, 100 units. The diluent amount, 101 ml. That matches, that matches. The concentration we're looking for is 0.99 units per ml. That's correct. So we're going to put in a dose of 3 units per hour. So I'm going to put in 3. That gives us a rate of 3 ml per hour and a volume of 101. That's all correct. I'm going to confirm that. Okay, we'll put that down. Before we start anything, I'm going to get a second nurse to come in and independently check all of my calculations. I'm going to make sure to put this into the IV there. Make sure that it takes it properly. So there it does have it. So after our nurse comes in and independently verifies everything, I'm going to note that we do have a Y port here that is already flushed, so we don't have to flush that. Maintaining sterility, I'm going to open up our alcohol swab. I'm going to swab that port off for 30 seconds, let it dry, and we're going to attach our line there. I'm going to make sure that all our clamps now are unlocked. Everything's unlocked, our carrier is unlocked. We're going to then tell the patient that their insulin, we're going to be infusing it now. I will push start. And we're going to make sure that we see at least 1 drip. It is a very slow running medication, but we will wait to see at least 1 drip. After that, I made sure all my clamps are unlocked. I'm going to make sure to lock our our IV pump here so that he can't inadvertently change any rates on there. I'm going to let the patient know that their medication is running now. I have labeled my line as well. I'm going to ask them if they need anything else. I'll put the bed to the lowest position, make sure that the call bell's within reach. Side rails are up as appropriate. I'm going to do my exit safety check, and then I will make sure to document. I'll document on the MAR with the second nurse's signature, and document any other pertinent information on an IP under that. And that's it.